Welcome to the deep dive. If you've been around horses, you know how incredible they are. Just majestic animals.
Absolutely. Powerful, graceful.
But sometimes, even with these amazing animals, you notice these subtle changes, things that make you wonder.
Mm-hmm.
And one that can be really perplexing is hair loss. Maybe you see a bare patch, or the mane's looking a bit thin.
Or just the coat seems off. Not quite right.
Exactly. And you immediately think, okay, what is going on here?
Yeah.
So today we're doing a full deep dive into equine hair loss, alopecia, as it's technically known.
Right.
You've brought us some really great source material. And our mission, really, is to equip you with a solid understanding of why horses lose hair, how vets kind of play detective to figure it out, and importantly, what can actually be done.
And what's really fascinating, I think, is that hair loss in horses, it's almost never just one thing.
Right.
It's usually a symptom, a sign pointing towards something else happening underneath. And these underlying causes, they can range from, well, surprisingly simple things to really quite complex issues.
So understanding that is key for an owner.
It's your biggest asset, really, knowing what to look for.
So let's start right at the basics then. When we talk about equine alopecia, what exactly is it? The material defines it as fewer hairs per area, or maybe hairs that are shorter than normal.
That's the gist of it. Essentially, it's just a loss or a lack of hair where hair should normally be growing.
Okay. And I gather it falls into two main buckets, right? Two main categories.
That's right. The very first split a vet thinks about is this congenital or is it acquired?
Congenital meaning from birth.
Exact. Present from birth or very, very shortly after. Now, this is actually quite rare in horses.
Oh, really?
Yeah. And it usually points to some kind of fundamental issue with how the hair follicles themselves developed or maybe didn't develop properly in the first place.
It's like a problem with the hair-making machinery itself.
Pretty much. And while it's not always genetic, it often does have an inherited basis. We just don't always know the exact way it's passed down.
Okay, so that's congenital, born with it. What's the other type?
The other type is acquired alopecia, and that means it develops over time.
Ah.
So the horse was born perfectly normal coat, healthy follicles, but then later on, something happened. Some kind of disruption occurred that caused the hair to fall out or stop growing properly.
Wow. Okay. That congenital versus acquired thing sounds like a massive first clue.
It is.
So just knowing if the horse was born like that or if it developed later, that's like the first major decision point for a vet.
Absolutely. It changes the whole direction. With acquired, we're looking for something that interfered with a normal process.
Right.
With congenital, we're thinking about abnormal development or maybe even a total lack of the structures needed to grow hair right from the start.
Gotcha.
Like the sources mention congenital hypotrichosis, which basically just means less hair than normal or none at all. That's been seen in certain Arabian horse lines and also in blue roan percherons.
Interesting specific breeds mentioned there.
Yeah, and another example is in Appaloosas, particularly those with certain foundation bloodlines. They can sometimes get this condition affecting just the mane and tail hair. It just doesn't grow right, or it's really sparse, called mane and tail hair dystrophy.
Okay, this next point from the material really caught my eye. One of the very first things a vet tries to figure out, and a huge clue for you as the owner, is simply, is it itchy or not? That's a massive clue, isn't it?
Oh, enormous. Absolutely massive. Think about how hair loss happens fundamentally.
Okay.
Either the hair is physically breaking off or being rubbed off.
Makes sense.
Or there's an issue with the immune system. Maybe it's overactive or underactive. Or there's just a disruption in the hair's normal growth cycle.
Right.
But if the horse is itching, that points us strongly towards an inflammatory cause. Something is irritating the skin.
Okay, so itchiness equals inflammation. Most likely. Like what?
Well, top of the list, you have to think about parasites.
Bugs.
Exactly. Lice, for instance. Really common, especially in winter. They cause this intense itching, so horses rub and rub.
Leading to patches of hair loss.
Yep, especially around the mane, the tail, neck, flanks. Then you've got mites, which cause mange. Less common than lice, thankfully, but can be really severe.
Nasty stuff.
Definitely. Those coreops mites, for example, love the feathered legs on breeds like giraffes. They cause intense itching, stomping, just misery.
I read about a surprising one too, pinworms. How do they cause hair loss?
Yeah, it seems counterintuitive, doesn't it? But the female Oxyuris equiworm lays her eggs right around the horse's anus.
Oh.
And those eggs are incredibly irritating, causes intense itching right there. So the horse backs up to anything it can find, fences, walls, feeders, and rubs its tail base raw.
Ah, leading to the famous rat tail.
That's the one, all from rubbing. And then there's sweet itch.
Right, the allergy.
Exactly. Culicoids hypersensitivity. It's an allergic reaction to the bites of tiny little gnats or midges. Causes horrible itching, usually along the mane, the tail, and down the belly line.
So parasites are a huge group for itchy hair loss. What else causes that kind of inflammation?
Well, moving beyond the creepy crawlies, you also have infectious skin conditions.
Like skin infections.
Precisely. A really common one is rain rot or rain scald, technically called dermatophytosis,
Okay.
caused by a bacterium, Dermatophyllus congolensis, that just loves damp conditions. So you see it more in wet weather.
And what does that look like?
You get these sort of matted tufts of hair with crusts and scabs underneath, and when you lift off the scab, a clump of hair comes with it, often leaving a little patch of raw skin.
Ouch. Yeah.
Then there's ringworm, and it's so important everyone remembers it's fungal, not a worm.
Right, despite the name.
Exactly. It's highly contagious, spreads easily between horses, and even to people sometimes.
What are the signs?
Usually you see these classic circular patches of hair loss. They might be scaly, maybe crusty, sometimes itchy, sometimes not, often on the face, neck, shoulders, or trunk, caused by trichophyton or microsporum fungi.
Got it. Fungus, not worm.
Definitely. And then you can also get bacterial folliculitis, which is basically just an infection of the hair follicles themselves.
So infection right at the root of the hair.
Yep. Leads to little bumps, maybe some pus-filled ones, crusting, and patchy hair loss. Often this happens secondary to something else that damaged the skin barrier first.
Okay. And allergies, besides sweet itch.
Oh, yeah. Other allergic reactions absolutely fit here, too. Things like contact dermatitis, reacting to something touching the skin, or atopic dermatitis, which is more like environmental allergies, pollens, and such. Insect hypersensitivities in general. All can cause inflammation, itching, and subsequent hair loss.
So the big takeaway for you, the listener, seems to be, if your horse is itchy and losing hair, think inflammation. Think parasites, infections, allergies first.
That's exactly right. Your observation of that itchiness is probably the single most powerful clue you can give your vet. It really narrows down the possibilities.
Fascinating. Okay, so we've dug into the itchy side. But what happens if the horse isn't itchy? The skin looks okay, maybe a bit bare, but no scratching. That must send the investigation down a totally different road.
Completely different road, absolutely. That's when we start thinking about the non-inflammatory causes.
Where the skin itself isn't the primary battleground.
Exactly. And honestly, one of the most common causes here is simple friction or trauma.
Like tack rubbing.
Precisely. Ill-fitting saddles causing wither rubs, girths causing girth galls, blankets rubbing shoulders or hips, even halters rubbing the face.
So equipment issues.
Big time. But also just constant pressure from lying down in the same position all the time can cause bare patches, especially on bony areas, or stable vices, like if a horse habitually rubs against a wall.
Okay, so physical rubbing. What else?
Nutritional issues can sometimes play a role, though maybe more subtly. Well, a severe lack of protein can definitely lead to a poor, dull coat that might break easily. And imbalances in certain trace minerals like zinc or copper have been implicated sometimes.
Anything specific stand out nutritionally?
Yes, actually. While deficiency is maybe more common overall for poor coat quality, selenium toxicity is a really important one to know about for actual hair loss.
Too much selenium.
Exactly. If a horse gets into feed or supplements with way too much selenium or glazes on selenium-rich soil, it can cause quite dramatic hair loss, especially the mane and tail hair. It can almost seem to slough off. And it affects their hooves, too, causing cracks and problems. Copper deficiency, conversely, is sometimes linked to coat issues, too.
Wow, okay. So minerals are important, both too much and too little. What about internal factors? Hormones?
Definitely. Hormonal imbalances are on the list. The big one, especially in older horses, is PPID.
Pituitary pars intermediate dysfunction, what people often call Cushing's disease.
That's the one. Very common. One of the classic signs is that long, shaggy, often curly coat that just doesn't shed out properly in the spring. That's called hirsutism.
Right, the woolly mammoth look.
Exactly. And sometimes, alongside that, they can develop patchy hair loss as well.
Any other hormonal triggers?
Well, you can sometimes see temporary hair thinning related to the major physiological shifts of pregnancy or lactation, just the demands on the body.
Makes sense.
But it's important to note, true primary hypothyroidism, low thyroid function, is actually considered very rare as a direct cause of hair loss in horses, unlike in some other species.
Good to know. Okay, what about the immune system acting up, but without causing itching?
That falls under autoimmune diseases, where the body mistakenly attacks its own tissues. In this case, the hair follicles.
Are those common?
No, thankfully, these are generally quite rare in horses.
Okay.
But one example is alopecia areata. The immune system attacks the hair follicles, leading to these very distinct, well-defined circular patches of complete baldness. No itching, no inflammation usually visible.
Where does that tend to show up?
It can be on the mane, the tail, the face, the body. And interestingly, in some severe cases, it can even affect hoof growth and quality.
Wow. Any others?
There are others like pemphigus foliaceus or lupus, but again, extremely rare causes of hair loss.
Yeah, okay. So rare, but possible.
Mm.
What else is on the non-itchy list?
Something we see is what's often called stress-induced shedding.
Like when people lose hair after a stressful event.
Exactly the same idea. The vet terms are telogen effluvium or sometimes anagen effluvium.
Fancy names.
They just describe when in the hair growth cycle the disruption happens, but the trigger is usually some kind of major stressor.
Like what kind of stress?
Oh, it could be a high fever, a serious illness like colic or pneumonia, major surgery, even a bad reaction to a medication, or sometimes even certain feed supplements.
No, supplements.
Yeah, if there's an adverse reaction. The key thing is the hair loss doesn't happen immediately. It usually shows up weeks or even a month or two after the stressful event.
Delayed reaction.
Exactly. It's often widespread shedding kind of all over. But the good news with this one is that once the stressor is gone, the hair almost always grows back completely fine on its own.
That's reassuring.
Definitely. And then, of course, we circle back to those very rare genetic or congenital conditions we mentioned earlier, where a horse is born with missing hair.
Right.
And finally, never forget normal seasonal shedding. Especially when they blow their winter coat, it can look alarming sometimes, but it's perfectly normal.
Good reminder. Okay, this is truly like being a detective. So many potential culprits. If you, the listener, are seeing hair loss and you've noted if it's itchy or not, what's the vet's process? How do they actually start narrowing this down?
It's absolutely a systematic process, like peeling an onion layer by layer. And it always starts with taking a really detailed history.
Talking to the owner.
Critically important. The vet needs to know, when did it start? How long has it been going on? Is it stable or getting worse? Spreading. And that crucial question again, is the horse itchy? Pruritus, we call it.
Okay, what else in the history?
The pattern where on the body is the hair loss. Is it symmetrical, the same on both sides, or random? Are any other horses in the herd affected? That's a big clue for contagious things.
Right.
And then a deep dive into management. What's the diet? Any changes recently? What kind of tack is used? How does it fit? New blankets, new pasture, new horses, any treatments already tried? How is the horse's general health otherwise?
So many questions. It really makes you think, as an owner. What details stand out to you about your horse's recent life and history?
That's exactly the kind of thinking that helps the vet immensely. After the history comes the physical examination.
Looking the horse over.
Yep. General health check, first vital signs, overall condition. But then a very focused, detailed skin examination.
What are they looking for specifically on the skin?
They're noting that pattern again, focal, one spot, multifocal, several spots, or generalized all over, symmetrical or not. Then looking closely at the skin surface itself. Is there redness, scaling, crusting? Crucial details. Are there small bumps called papules? Or bumps filled with pustules? Are there thicker lumps, nodules? Has the skin turned darker, hyperpigmented, or thicker and leathery looking, which is lichenification?
Okay.
And very importantly, are there signs of self-trauma? Scratches, raw spots, broken hairs, what we call excoriations, which points back towards itching.
So even if you thought it wasn't itchy, the skin might tell a different story.
Exactly. They'll also look at the hair quality itself. Is it snapping off or falling out from the root? And they'll gently palpate, feel the skin, check for any pain or swelling.
All right, so history, then closed physical exam.
Yeah.
What test might come next?
Based on those findings, the vet moves to specific dermatological tests.
Okay, lab tests.
Some are done right there, some sent off. Skin scrapings are fundamental if you suspect mites. The vet scrapes the skin surface gently with a blade to collect debris to look at under the microscope.
Okay, scraping for mites.
Hair plucks, or a trichogram, are also common. Plucking hairs from the edge of the affected area and examining them under the microscope.
What can you see on a hair pluck?
You might see fungal spores on the hair shaft, suggesting ringworm. You might find lice or their eggs. You can assess the hair bulb to see if it's falling out in the resting phase, telogen, or growing phase, anagen. And sometimes you see abnormal hair shafts, like those weird exclamation point hairs that can be a clue for alopecia areata.
Wow, a lot from just a few hairs.
Indeed. If ringworm is strongly suspected, a fungal culture is the gold standard. You take hair and scale samples and put them on a special medium to see if fungus grows. It takes a week or two, but it's the most reliable way.
Got it. Culture for fungus.
Then there are direct impression smears or tape strips. You press a microscope slide or special tape against the skin surface to pick up cells, bacteria, or yeast.
What does that show?
It can quickly show bacteria or yeast overgrowth. And sometimes you see characteristic things like the railroad track appearance of the Dermatophytosis bacteria that causes rain rot, or you might see inflammatory cells.
Okay, what if those tests are still not giving a clear answer?
That's when a skin biopsy often becomes necessary.
Taking a small skin sample.
Exactly. A veterinarian takes one or more small circular punches of skin, including all its layers, under local anesthetic. It gets sent to a pathologist for a microscopic examination.
When is biopsy most useful?
It's crucial for diagnosing immune-mediated conditions like alopecia areata or pemphigus, also for skin tumors or just any persistent case where the other tests weren't conclusive. For alopecia areata specifically, it can be challenging. Sometimes you need multiple biopsies from the edges of new lesions.
Okay. Any role for blood work?
Sometimes, yes. General blood work, a CBC and chemistry panel, can help assess the horse's overall health and rule out underlying metabolic issues. If PPID is suspected based on signs like the coat changes, specific endocrine testing is needed. And if a nutritional issue like selenium toxicity or copper deficiency is suspected, mineral analysis of blood or feed might be warranted.
So it's a really layered approach, putting all the pieces together.
It has to be. History, exam, targeted tests, all leading towards that crucial diagnosis.
Okay, so let's say the detective work pays off. The vet figures out the why. What happens next? How do we actually treat the hair loss?
Well, this is the most important principle. Treatment is completely dependent on getting that diagnosis right.
You can't just treat hair loss.
Exactly. There's no single magic bullet, no specific hair growth drug approved for horses like there is for humans sometimes. You have to identify and address the underlying cause. That is paramount.
Okay, so fix the cause, fix the hair loss.
That's the goal. Now, there are some general management things that help in many cases, regardless of the specific cause.
Like what?
Good environmental management, for one. Keeping the horse's living area clean and dry is huge, especially for infectious things like rain rot or wingworm. Removing any sharp objects or rough surfaces they might rub on is also important.
Basic stable management stuff.
Crucial stuff. Good hygiene, too. Regular grooming helps keep the skin healthy, using appropriate shampoos if needed, and making sure the horse is dried thoroughly afterwards, especially in damp weather.
And the tag fit we mentioned.
Absolutely critical. Ensuring saddles, bridles, blankets, everything fits properly prevents those friction rubs that can cause bald patches. Check it regularly.
Makes sense. What about contagious conditions?
If you've diagnosed something contagious like lice, ringworm, or even severe rain rot, quarantine is essential.
Isolating the affected horse.
Yes, to prevent spreading it to others. And, just as important, thoroughly cleaning and disinfecting all shared equipment brushes, tack, blankets, feeders, stalls, everything.
Okay, those are good general rules. What about specific treatments for the categories we talked about?
Right. So if it's a parasitic infestation, for lice or mites, you'll use specific topical treatments like insecticidal shampoos or sprays, or sometimes systemic medications given orally or by injection. For pinworms, it's about using the right dewormer that targets them effectively.
And for sweet itch, that allergic reaction.
That's multifaceted. Strict insect control is number one, using fly sheets, masks, repellents, stabling during peak gnat times. Then, managing the itch often requires corticosteroids or antihistamines, especially during flare-ups. Some people try omega fatty acid supplements, and long-term allergy testing and desensitization shots, immunotherapy, can be an option for some horses.
Okay. What about the infectious skin conditions, like rain rot?
For rain rot, gently removing those crusts helps. Clipping affected areas if the hair is long can allow treatments to penetrate better. Using antimicrobial shampoos containing chlorhexidine or povidone iodine is key. In severe cases, systemic antibiotics might be needed. But the absolute most important thing for rain rot is keeping the horse dry. Protect them from rain and moisture.
Makes sense, given the name. And ringworm, the fungus.
Ringworm requires antifungal treatments, usually topical shampoos or rinses with ingredients like meconazole or analconazole. Sometimes, especially for widespread cases, vets might prescribe oral antifungal medication like grisafulvin. And again, environmental decontamination is vital because the fungal spores can survive for a long time.
Cleaning everything. Got it. Bacterial folliculitis.
Similar approach, topical antimicrobial shampoos are the first line. If it's deep or widespread, systemic antibiotics based on culture results might be necessary.
Okay. How about allergic reactions that aren't sweet itch?
The first step is trying to identify and remove the allergen, if possible, which can be tricky. If not, managing the symptoms often involves corticosteroids, used carefully due to side effects, antihistamines, maybe those omega fatty acid supplements again. Allergy testing and immunotherapy might also be considered here.
And if it's nutritional, deficiency or toxicity?
That's usually straightforward once identified. You correct the diet, provide a balanced ration, add specific supplements if a deficiency like zinc or copper is confirmed, or crucially, remove the source of toxicity, like finding and eliminating the source of excess selenium in the feed or pasture. Sometimes biotin is supplemented for general coat and hoof health, too.
What about the hormonal one, PPID?
For PPID, the standard treatment is medication, specifically pergolide. And while it's treating the underlying disease, it very often leads to a significant improvement in the coat quality and shedding pattern. The hair loss might resolve.
And those rare autoimmune diseases.
Those usually require medications to suppress the overactive immune system, most commonly corticosteroids. But these need very careful management and monitoring by a vet because of the potential side effects of long-term immune suppression.
Right. So it really hammers home that point. You absolutely need the right diagnosis to choose the right treatment.
Couldn't agree more. Throwing treatments at it without knowing the cause is usually ineffective and can sometimes even make things worse.
So it feels like a journey, from seeing the problem, doing the detective work, getting the diagnosis, and then starting the right treatment. And you mentioned earlier, the good news is, once you treat that root cause, you usually see the hair come back.
That's generally the case, yes. The prognosis for hair regrowth is usually quite good, provided you've accurately identified and effectively treated the underlying issue.
But is regrowth always guaranteed?
Not always. There's an important distinction we make. Cicatricial versus non-cicatricial alopecia.
Scarring versus non-scarring.
Exactly. Cicatricial alopecia means there's been permanent damage and destruction of the hair follicles, usually due to severe inflammation, infection, or trauma that resulted in scar tissue formation. In those specific scarred areas, unfortunately, the hair won't grow back.
Ah, okay. Permanent loss in that spot.
Yes. But in non-cicatricial alopecia, which is more common for many of the causes we discussed, the follicle itself isn't permanently destroyed. So if you remove the causes, kill the mites, clear the infection, balance the hormones, stop the hormones, rubbing follicle can recover and start producing hair again.
That's encouraging for most cases, then.
Very much so. And conditions like telogen effluvium, that stress shedding, that resolves on its own once the horse recovers from the stressor. The hair comes back.
What about things like PPAD or sweet itch that need ongoing management?
Right. For chronic conditions like those, you're managing them long-term to prevent flare-ups or control symptoms. You might not cure the sweet itch allergy, for example, but with good management, you can keep the horse comfortable and minimize the hair loss during the allergy season. Same with PPID, the medication helps manage the condition, which usually improves the coat significantly.
So wrapping this up, what does this all really mean for you, the listener, the horse owner or enthusiast watching their horse? It sounds like it really underscores how important just paying close attention is.
It really does. Keen observation is your first and maybe most important tool.
And taking a systematic approach. If you do see something, don't just panic, but think about the clues, itchy or not itchy, or is it, when did it start?
Absolutely, because hair loss, as we've seen, it's rarely just skin deep. It's often a flag, a signal from the horse that something else is going on. Your role as an observer, noticing those changes early and gathering those clues, is just paramount in helping your vet get to the bottom of it quickly and effectively.
It connects back to just being a really good caretaker, doesn't it?
It does, being an attentive steward for your animal. And, if we think about that bigger picture, it really raises an interesting question, doesn't it? Beyond just hair loss, what other, maybe even more subtle shifts in your horse's appearance or their behavior might be trying to tell you something really important, if only you knew how to deep dive into reading those signs?